in the hospital. And ENT is all about the ear, the nose, the throat, and the head and neck region. And this is very fitting that you are here because you are actually our earpiece, and you will now be our mouthpiece. Now you will also extend that awareness to the population out there. There are only few of us, even specialist nurses, we have few in the country. And this is a specialist field, and out there in the peripheries, they don't really know what mouth cancer is. But that is a challenge for us. That in itself is already a stage 4 cancer, which we cannot operate on. So this is the message for you as good people who extend and expand our service to the public, is for you to be healthy first. So we have set up a station here to just have a look at your oral cavity and assess your ear, the nose, make sure you are fit to go and continue your service. So many of you have already been talking about head and neck cancers and mouth cancers, and that is one of the biggest burden that we have in the country. So cancers in the country, head and neck cancers, mouth cancers is one of 3 important, or say the highest incidence in the country amongst breast cancer and cervical cancer. And for the country, only ENT specialists deal with the head and neck and the mouth cancers. We only have 13 specialists in the country, 12 local trained specialists, 13 in total. And they are serving a population of 10.18 million. Now the global standard, the world standard says that there should be 1 ENT specialist or otolaryngologist for 40,000 population or residents in a country. For us, it's 1:783,000. That's very, very big. And that you can imagine the pressure, the challenge, the issue that we have as specialists. And every day, patients send a message to me and say, please, one time I'm operation below me. And it's very saddening because we don't have the capacity to treat every patient. We want to see patients coming in at very early stages, stage 1 and stage 2, 4+ stages. Once it reaches stage 4, we cannot do anything much. But we can help when it's stage 1 and do smaller surgeries. For stage 3 and stage 4, we do 10 to 14 hours of surgery. And just imagine in our facility here, we only have 2 theater days. And for 1 case, we can spend a whole day just to do 1 cancer surgery. 1 cancer surgery in the whole week, and the rest get canceled. That's the biggest challenge. And big worry too. There are so many patients who are in the ward who are still waiting for surgery. And whilst they are waiting, their cancer progress. From stage 3, it goes to stage 4. Now, talk sorry through, hard now walk long in. We feel sorry for them. We give them some alternatives, chemotherapy, radiotherapy. But that's a big challenge. So most of the cancers that we see will progress into stages which we cannot care for, which we want the families to also come in and also assist. On a daily basis at the clinic, we see 7 to 10 new cancer cases, and that's a lot. 7 to 10 new cancer cases is a lot. The process of preparing them for surgery is quite big as well, and by taking weeks before we prepare them for actual surgery. The 3 most important things which cause cancer in mouth cancer is betel nut with lime, smoking, and alcohol. Don't think that now I'm healthy now stop na I'm all right. In the next 5 to 10 years, it can become cancerous. The cells can actually change to cancer. The cells can burn from chewing this betel nut na lime, and it can become cancer. Just now we are admitting one patient who had a cancer in the throat. Now me ask him, because cancer in the throat, smoking is number one. And he hasn't been smoking for the last 30 years, but he smoked when he was young for 3 years. But eventually CKM combined him. So the message is to young people is to not to start smoking, not to start chewing betel nut, not to start drinking alcohol. That's the message that we want to portray to young people and community schools. So that's for cancers. The most important thing is not look in triple sign or some, so come up, now you come lao sit. The message is not that. The message is you look, suppose you got pain or color change in the tongue or small sore, come quickly to the hospital. Then we can assess and then say whether it's cancer or not and help people. So that's the message we want to bring to the public about mouth cancers. Now the ear. This is one of the most neglected conditions, ear diseases, neglected conditions in health. So many kids out there have ear conditions because we are from the coastal, mostly plenty coastal stuff, plenty ear diseases are coming from the coastal regions. And kids are coming, and it's affecting their schoolwork and their intelligence. So that's one of the things that we want to bring to do screening in the schools. That's one of the things that we have yet to do and progress into to improve screening for schools. So for school kids, it's very important that they're healthy, their hearing is good before learning something. Plenty of kids are not doing well in school is because of hearing problem, and it's never detected in their lifetime. So that is one area that we want to do is to go out into the schools and do screening.